Since the outbreak of COVID-19, different measures by governments have been taken in an effort to contain it. Some of these measures include lockdowns, social and physical distancing, as well as the use of face masks, as well as hand washing, among others. Despite the fact that government is trying its best to see that the awareness campaigns get to the nooks and crannies of Nigeria, many Nigerians still behave as if the coronavirus is just like malaria, while others totally believe that it does not exist. Now, what have relevant agencies done in creating the desired awareness? What can be done to make Nigerians come to terms with the reality of the times? Citizens of other countries are not in denial, so what is making Nigerians different? Face masks have in many countries, including Nigeria, become mandatory. Now, how safe are they, especially the ones sold on the streets? And how should the vendors handle them? These will form part of our discussion tonight. Welcome to Nigeria Today. I'm Dennis Adigunloye. Now, joining me to discuss our topic for tonight is David Akoji, Special Assistant to the Director General of the National Orientation Agency, NOA. Welcome once again to Nigeria Today.
Thank you, Dennis. Pleasure to be here.
Thank you. All right, and also joining us is Dr. Ayo Olusmeyor David, a medical practitioner. Thanks for joining us on the program.
Thank you. Always a pleasure.
All right, let me come to you first, Doc. From reports, we can see that some, like I said in my intro, people are still in some kind of a denial as to the veracity of this virus that we all know as COVID-19. What can you say concerning this?
It's rather unfortunate because we are at a point where nobody should deny the existence of COVID-19 as a disease, but all over the world, we have seen these cases repeat themselves. Lombardy, Italy had the same situation where people did not really believe that COVID was a real thing. So they ignored the lockdown orders, they ignored the stay-at-home orders, they ignored social distancing orders, and they went out to parties. We saw the same in the US, we saw the same in the UK, and we are seeing the same in Nigeria. However, we can learn from their mistakes. We can show people that they exist. There are so many strategies that we could use in these. We could. I mean, if you don't know someone who has it, you really will not believe that it exists.
Yeah.
So we can liaise with community leaders. We can liaise with so many people that communities believe in, they look up to, they trust, they respect, and hold town hall meetings, something small. You know, so many awareness campaigns that we can employ in order to get people to believe that it exists. Because once people believe it exists, we'll start to see a flattening of the curve.
Sure.
Because people will start to adhere to lockdown rules, people will start to stay indoors, people will start to wear masks, you know, and stay safe generally.
That's certainly what we want to see. All right, thanks for giving us that foundation. And before I come to David Akoji, let's just take this report from Gombe State.
People who tested positive for COVID-19 at the Kodom Isolation Center in Gombe State broke out of isolation to protest for what they call better care for one of them sick with injury, and they believe that they are not sick with COVID-19.
We blocked
the road because one of us is sick with cancer and we want her to be taken home. If we don't take action, as she dies here, it may be alleged that she died of coronavirus. People from the community hosting the isolation center came out in large numbers to join the protesters. While some believe that COVID-19 is real, others say they don't. Personally, I don't believe that there is coronavirus. How do I get the virus when I have never entered an aeroplane and traveled abroad? In its regular briefing to give update on the disease, Task Force on COVID-19 in Gombe State lamented the action of the people who tested positive for COVID-19 and the community who joined in the protest, describing the action as catastrophic.
I know that people talk about fundamental human rights,
People talk about democracy or whatever. This virus does not understand any of that. The virus understands how to take your life. And government has put in place regulations to stop people from spreading this virus. And they will violate those regulations.
We need to, improve on the level of, enlightenment and sensitization.
As at the time of this report, Gombe State has 101 confirmed positive cases of COVID-19.
All right, welcome back to the studio. That report from Gombe. David, you heard from the horse's mouth or horses' mouths on that report, clear cases of denial of the existence of COVID-19. Just give us your impressions of what you heard.
Well, what we have seen on that clip from Gombe is disheartening. It's disheartening on many levels. The challenge of disbelief is not peculiar to Nigeria. It's also not altogether strange. At the onset of the coronavirus pandemic, we had some world leaders openly deny the existence, of the pandemic.
Even now, we still have that with the Brazilian president.
Absolutely.
Yeah.
Back home in Nigeria, we have had several mixed messaging from opinion leaders, religious leaders, traditional rulers, and top politicians disputing the existence of the coronavirus pandemic in Nigeria. Now, many of these people have large following. Their voices resonate, with members of the public across the country. And so when they speak and they show disbelief, it affects the perception that ordinary Nigerians have about the virus. That's at one level. At the other level, unfortunately, in Nigeria, we are a people that want to see things directly in front of our nose.
Seeing is believing.
Yes, before we believe in the way that we ought to. The majority of people at the grassroots are not privileged to watch CNN, Al Jazeera, and all these international channels to see how this virus is affecting other countries with more advanced health systems, with citizens who are not hard-hearted, and adhere even to the protocols that are supposed to ensure prevention. Here in this country, it's extremely difficult to get people on the side of belief. And largely, that's because they have not seen people falling down next to them with this disease and its impact. And we thank God that this country has not gotten to that stage. It happened in China.
Yeah.
It happened in some of these countries where the disease actually ravaged citizens of those countries. We are not safe, especially in the light of the relaxation of the lockdown, the partial relaxation of the lockdown. Nigerians need to recall that our leaders deemed it fit to impose a lockdown when our contagion rate was less than 100 or thereabouts. Today we are looking at contagion rates of 2,950. And this is only an outcome of the tests that have been conducted.
Wow.
And so I think it's a time to be circumspect. I think it's a time for Nigerians to take responsibility for their own personal safety.
Sure.
Now, we live in a country where there's so much distrust for government, and where everything is seen from the perspective of how much money is going where.
Let's not digress too much into mistrust of the government. Let me bring Doc in here. Moving on from that, this idea of conduct on the part of Nigerians, there's another concerning issue that is seems to be on the rise now, and that is the issue of the face mask and how it is being sold and developed and given to the public, basically. There's a lot of talk about face masks being shared, being tested, as though you're buying a item of clothing. Let me see if this one fits me. How does it look with my attire? Just explain to us how this level of ignorance, I dare say, has it got to this stage?
COVID-19 is one of the most infectious diseases in recent history. That's why it has risen to the point of being called a pandemic. Now, we are worried about human-to-human transmission, you know, touch me, touch you, sneeze on me, sneeze on you, touch my table, things like that. Now, we have added a new dimension to it, which I'm very sure has not been seen anywhere in the world, face masks.
Yeah.
I agree that everybody wants to stay safe. Everybody wants to be in a position to go out and make some money for their families, which is why the lockdown was relaxed, thanks to Mr. President, you know, considering all those factors. But we have, just like Mr. David said, Nigerians want to make a lot of money. So some people see it as brisk business, sewing some face masks and selling it to the public. But again, this is also a function of information dissemination. I got a document written by the NCDC about face masks. What you should look out for. Face masks should have double layering. Some should have fiber in the middle, just so it's protective enough. Things like that. Don't share, wash once a day, you know, use properly. But can the average Nigerian have access to that kind of document? Even if we put it on TV, radio, all other mediums, can the average Nigerian have access to it? Do they know these guidelines? I want to believe that a lot of people are doing that out of ignorance. You know, once you put on a face mask and you remove it, even if it's just for 30 seconds, you cannot put on that face mask again. If it's a disposable one, you dispose of it. If it's a cloth one, you wash it, disinfect it, and either iron it or put it in a microwave before you wear it. How do you know that the person trying on a face mask is not infected with COVID?
Exactly.
And then the next person comes to buy innocently, and that's it. Because we all know the virus stays on surfaces for 8 hours.
But surely that risk cannot be lost on people who are purchasing from the vendors. I can't understand how
it cannot be. So I think we just forget along the line, you know, and we forget the core of the matter. Right now, when we see celebrities, governors, singers, musicians, they wear matching face masks with their attires, and we want to do the same. We forget the purpose of the mask itself. Secondly, I see a lot of Nigerians putting their masks on their chains. The minute you do that, it becomes useless, because you could infect yourself with COVID. I mean, if it falls on your skin for whatever reason, you can go home, have your bath, clean yourself, and it's done. But once you do this, and the mask touches your chin, and you put it back, that's the end. There are so many misconceptions that we need to teach. Wearing the mask is one thing. Taking it off is another thing. A lot of us miss the fundamental, and I don't blame them. It is a dearth of information. It just doesn't get to the people who need it the most.
Absolutely. All right, David, following on from that, we also hear cases of taxi drivers who keep them on hand in their cars. When they get passengers, they'll say, put your face mask on, otherwise we're not going anywhere. Once they drop, they'll return the face mask. Again, this is a dangerous practice, isn't it?
It's extremely dangerous. That's absurd. It means...
More than absurd, yeah.
It means all the sensitization efforts are yet to strike the right chord.
Yes.
That should be very seriously discouraged, you know, and we are going to focus on messaging in that respect at National Orientation Agency. We're going to include that in the plethora of messaging that we're doing at the moment. A lot is being said about the need to increase awareness creation and sensitization. And many fingers are pointing at the National Orientation Agency.
Yeah. What are we doing to improve on this enlightenment?
Yes. The thing is this. There's a national response strategy to COVID-19, which is coordinated by the Presidential Task Force on COVID-19. Coronavirus is not your everyday sensitization kind of scenario. this is a disease, a virus that is highly contagious. And it's a virus that even medical experts are trying to fully understand. And so the thinking at the level of the Presidential Task Force and the Risk Communication Committee of that Presidential Task Force is that medical expertise is required to do sensitization on this.
Of course.
And as a result, the people who are in the front line for awareness creation and sensitization are the health educators and health promotion officers who are domiciled in local governments, in states, driven by the National Primary Health Care Agency and the state primary health care agencies. What National Orientation Agency is doing is giving support.
Okay.
Support in terms of, okay, what is the message that you want us to carry? How do you want us to carry it? And then we are working in groups with these primary, health promotion officers. And they're the ones in the lead because they have the expertise. They have the capacity to identify situations that should bring about caution, you know. So there's a lot that's been done at the level of the Risk Communication Committee of the Presidential Task Force on COVID-19. And these health promotion officers and the entire team across the 774 local governments are being trained. We're at the verge of deploying them in every community.
All right. Okay, we'll continue our discussions shortly. We'll pause here for a break. We'll be back in a moment. Stay with us.
COVID-19 transmission is mostly through droplets from sneezing and saliva. The most effective way to protect yourself from the virus is to practice good personal hygiene. Wash hands with soap under running water or use an alcohol-based sanitizer if water is not available. Maintain at least 2 meters distance between yourself and anyone who is coughing or sneezing. Cover your mouth and nose with your elbow or tissue when you cough or sneeze. Dispose of the used tissue immediately. If you have traveled recently to a country with COVID-19 outbreak in the last 14 days and you have a fever, cough, or breathing difficulty, call NCDC toll-free numbers before going to the hospital. This message is from the National Orientation Agency.
All right, welcome back. The program is Nigeria Today, if you're just joining us, and obviously we're still on the theme of most of what has been happening this year, and that is COVID-19 and the use of face masks. Let's now take a look at this silent video of a woman who is in the process of purchasing a face mask. We'll continue our discussions as the video unfolds. So just give us your comments as you watch this video unfolding. Doc?
I can see different points of transmission. Beyond the obvious ones, you know, you wear it, you breathe into it. She's touching every mask before she tries it on. You know, she touches, she wears it, she removes it, you know. So those are points of transmission. And you can't really tell how many people have done that before you come and then you buy. Just like NCDC says, if you have to use the cloth face masks, wash them and disinfect them before you wear them, even for the first time. These are very, you know, small but detailed and important points that could be the difference between life and death. But like I said earlier, are ordinary Nigerians getting the privilege of those messages?
All right, David, let's get your thoughts on what you saw in that transaction, if we can call it that.
What I think is that we're facing a big challenge. And this challenge is arising also from the fact of the situation that we find ourselves in today. Masks, ordinarily, are not items that you find on the street, being hawked.
Yeah.
To purchase a face mask, ordinarily you would have to go to a pharmacy, you know. And at the pharmacy, there's expertise in handling of masks. And these masks are well packaged. But today, because of the situation we find ourselves in, every Tom, Dick, and Harry is hawking face masks the same way as we hawk cola nuts and granuts and yams, you know, in the streets and in the markets. Now, that's a big problem. You know, I think we need to introduce some form of standardization. You know, that's the one sure way you can curtail this. This cannot be curtailed merely by sensitization.
What about punitive measures?
Yeah, because they would escalate the problem with this kind of attitude that you see being displayed here. So there has to be some form of standardization to say, if you must buy masks, these are specific places that you can get them, and this is how they should be packaged, you know. And so if they are properly packaged, then people would hesitate to open several packages before they make a choice of one, because that will come with its own consequences too.
But doesn't that create the same bottleneck that's got us here in the first place? Because how can we ensure that we can distribute masks to 200 million people?
You see, the points of purchase need not be scarce. In every community, in every village, you would find either a chemist or a pharmacy. This is the point I'm making. So it's the same thing with some of these drugs that we buy. You don't find them being hawked, you know, on the streets like that. And we discourage when we see that happening, even though people fall sick. And drugs should be available to 200 million people also. You know, and this is far more important than that, because it can become a potent source of transmission. So we want to stop that, and we think that some level of standardization should be put in place.
Sure. All right, so Doc, in terms of social distancing, since the easing of the lockdown, we've seen a lot of breaches. Even the PTF have said it themselves, especially at banks. We see large gatherings at banks. Some you even see them wearing face masks. They'll be clustered together. Again, this is demonstrating a high level of ignorance and disinterest, really, on the seriousness of the situation we're all in.
For this, public health dictates that a system has to be whole. A system has to, you know, be fluid. A system has to work for health to be maintained. Health is defined as a state of well-being of your physical, your mental, your social. Every single part of you must be healthy before we can say you're a healthy person.
Yes.
Now we have a system that is not exactly ideal, a system that doesn't really work. If we had a very functioning and robust mobile money system, internet banking that works, doesn't jam on you, ATMs that you can get willy-nilly, you know, you can do transactions without money. In Kenya, they have M-Pesa. We have things like that. I don't think we would see crowds at banks the very next day when the lockdown is eased. It's a function of people trying to get access to money, funds, so they can purchase essentials or do things that will keep them and their families alive. On this, I don't really fault Nigerians. Not entirely by my book.
All right, our time is up. Just briefly give us your words of advice to the public as we go forward.
We have to seek for information. Even if information doesn't come to us, we have to go find it, because there's not much food that we can eat when we're dead. Life and staying alive comes first. Put your life first, put your pocket second, and we will get through this as a country. It's a collective effort.
Absolutely. David, your last and final words?
Coronavirus is real. People are dying of it all over the country. The rich and the poor are like adults and children. And so we need to take responsibility to protect ourselves as citizens of this country.
It's very important. It's our lives are in our hands, and victory against this weapon of mass destruction is certainly ours to be won. All right, David Akoji, Special Assistant to the Director General of the National Orientation Agency. Thanks again for being with us on Nigeria Today.
Thank you for having us.
Sure, and thanks to Dr. Ayo Olusanyo David, a medical practitioner here with us. Thanks
Thank you. Thank you very much. Always a pleasure.
Sure. And thank you for watching, and we will be back for another edition of the program Nigeria Today tomorrow. I am Dennis Adigunloye. Thank you for watching.